8:01 p.m. here in Nigeria. My name is Dr. Frederick Unubohai, and I always tell you good life na sense. Now, this program holds every Sunday by 8 p.m. to 9 p.m. and we've been on this program for the past 5 years. So on this program, we go teach you, we go answer you many things. But I beg, we not go give you medicines. We not go make diagnosis for you online. If you get any medical condition, go hospital, go see your doctor. Now, today's program na question and answer session. I did live on YouTube, I did live on Facebook, I did live on my two Facebook pages. So if you get any question in the next 58 minutes, ask and I go see whether I go fit respond to you. My co-host now Dr. Israel and he go join us very soon. So how are you and where you dey watch me from? Where you dey watch me from? If you dey watch me on TikTok, enter YouTube or Facebook, I go answer you. But I no go answer anybody on TikTok, huh? I'm not going to read any question on TikTok. Come to my YouTube and my Facebook, I will respond to you. Yeah, make I see. Yes, Ivie Gloria. Ivie Gloria, good evening. How are you, Ivie? I can see you. Faith Stanley, Faith, good evening. How are you day? Yes, it's a Sophie Love. Sophie, how are you doing? Now I notice say a lot of people won't ask me questions. Uh-huh. So make I see whether I fit answer you sharply, and then Dr. Israel will join us very soon. Sophie is watching us from Cameroon. How is Cameroon now? Yeah, man. Yes. Well, yeah. Ask me the question. I go answer you. Huh? I did watch you right now. Let me see. Uh-huh. I did watch you right now. Let's see. From London, Faith Stanley is watching me from London. Eve Gloria is fine. I get 5 millimeter kidney stone after I go do ultrasound scan. What's your take? My take is that take your result and see your doctor. Yeah, take your result, see your doctor, make your doctor check you. They go check you, find out how your symptoms be, find out the location of your stone, and then give you some advice wey go help you. But I no think say na something wey you go panic about. Ademiluyi Deborah, good evening, ma. How are you? How you day? How you day? How you day? Yes, the people where they watch me from TikTok, join YouTube and Facebook. I go answer you. Uh-huh. Cameroon is fine. Cameroon, I see you. Ivie Gloria, watching from Italy. Oyana, how is Italy? Ivie, let's go, let's go. So, ask me. Yes, Victory, how are you? Victory is watching me from YouTube. Victory Day YouTube. Igwe Victory Day YouTube. They watch us. Yeah, I see you. Uh-huh. Okay, now. I beg. I know they do private chats. I know they give number online. That is why from time to time, I they come online like this to respond to you. Sure, you understand. I know they follow anybody chats. Can I chat with you privately? No. I know they give number, make anybody call me. So I they try come online like this so that if you get any question, you go free ask me and I go answer you. Here you get because my private time, they free. Hmm? Good evening. Dr. Israel is in the house. Yes, let me bring up Dr. Israel. Dr. Israel, they here. Okay, make I bring up Dr. Israel. Oh, waiting, I don't go press for this my screen right now. They come, they come, they come, they come, they come. Dr. Israel, they come. Yeah. Yeah. Oh, wait, Dr. Israel. Okay, yeah, I don't see him. I don't see him. Yeah, we are back. Anybody will want ask me question for TikTok, come to YouTube and Facebook. I'm I'm ending the TikTok live now. Huh? Uh-huh. Dr. Israel, good evening. How you day?
Good evening. Happy Sunday. How your
Yes,
side?
yeah, I did very fine. I see you. Happy Sunday to you. Yes, so were you on the live session last week? Yes, you did live session last week, Abi? Yes.
Yes, sir.
Yes, you did.
So
Yeah,
last 2 weeks now.
now last week, did now. So okay, so may we try see whether we fit take some questions, eh? Make we see whether we fit take many questions. Okay, so we get a question on YouTube. The person say, I have some unexplainable rash and I'm not okay with it. Like unexplainable rash. My advice to you now, make you try see doctor. He say, okay, wait, Dr. Israel. He says, I have done several tests, HIV and all, but nothing. I'm still confused. Dr. Israel, yeah, respond quickly. Maybe we go to the next question.
Yeah, you get rash. It depends on where the rash dey. If not all your body, and you said you have done tests. Then who give you all these tests? May you do now? You just go lab, go to do test, or you went to see a doctor before you do all these tests. I go advise say make you go see a dermatologist. Doctors wey dey specialize for skin matter and rashes matter. So when you see them, they go come tell you what to do, and if there's need for any investigation, they go do am for you. Also, e good make you know say most of these skin rashes, they no dey comot for person body immediately. They dey take time. Sometimes you need to treat am for more than a month, like 2 months or even more, before some go comot. While some fit comot, dem go come back again. So it depends on the kind of rashes and wetin dey cause the rashes. um and some fit be sey na some medication wey you dey take na dey even cause the rashes. So that's why you need to talk to a dermatologist, doctors wey dey specialize for skin matter. Then you go get your best solution for that rash.
Okay, if you just dey come, today's program na question and answer. Share this live session because I notice say a lot of people know they share their own na to just come here, ask you question and disappear. So before you start to dey ask question, share the live session so that more people go there aware. And then when we try see whether we fit answer Sophie. Sophie says, please, doctor, I saw my period last month. And a few days after my cycle, I started bleeding again for 3 days. And I want to know if it's possible for me to get my period on the exact date this month.
Okay, you first see your period. After the period, you start to dey see the period again 3 days later, and you see am for like 3 days. I don't know if that's the first time it's happening. So if that's the first time, okay, maybe we no wan talk too much. However, there's no guarantee say you go see am exact date this month, because cycle no dey really work like that. There are so many factors wey dey affect the cycle. When we say regular cycle, when we talk about regular cycle, no mean say na the same date na e go dey fall put. E mean say when you count from your cycle to from when you first start to dey see the menses till when e dey come back again, every time e dey almost the same number of days, like maybe 28 days always, or 26 days always. But this one wey e be say you first see, then later you come see again, there's everything there to say your cycle would have changed, or maybe you even take some medication wey cause the second bleeding. So they'll come make sure say that all those go fit affect your date this month. So there's everything there to say you no go likely see am as you take dey see am before. So if you come see am dis time and you come still notice another kind of bleeding after then, abeg go and see a doctor, see a gynecologist, because you never can tell why you dey see why you dey bleed like that or more than once. E no go make sense. So you need to see a gynecologist who will take you through so many things and tell you what to do, and then you may have the best.
Okay. Good evening. What is the cause of burning sensation after urinating?
If they get burning sensation after urinating or even before urinating or during urinating, there's every tendency say you get wetin we dey call urinary tract infection. So you go need to go hospital go see your doctor make dem run test for you, know wetin dey cause dat and den dem go treat am. And apart from dat, e fit be say dey have some bruises there, because urine can actually cause pain. So if you get some bruises, there's every tendency say you fit still dey get all those burning sensation or painful sensation after you urinate. But for the burning sensation, please see your doctor and they will likely um tell you what to do and treat you.
Okay, if you just dey come, you dey welcome. Let me see. A lot of people are not sharing the live session, so it's funny right now. Can you talk about people with just one kidney right from birth? And who be this? Your name now Emmanuel. So now it's in no dey common say somebody could get one kidney. No dey common. But if you get one kidney from birth and you don't discover them and you don't get any problem, the advice now may you continue to live your life. Most especially you see your doctor, make make dem check you and then avoid any other thing wey fit affect the kidney because na one kidney. Human beings can live with one kidney, nothing go happen at all, you understand? No be say because you get one kidney then your own don spoil. Many people dey live with one kidney, even they go fit donate one other kidney. But if you get one kidney from birth, then they go check you, find out many things, and if there is no issue with you, you live your life. No be something wey go dey make you dey panic, you understand? It can happen but it's not that common. If you never share the live session, share the live session quickly. Share. um who be this? Let me see. Okay, I dey check. Oh, happy Sunday, good evening. I dey check questions. Okay, there's a question here, Dr. Israel. It says, hi, my friend has been struggling with staphylococcus and she is finding it difficult to get pregnant. So she wants to know if it can be cured. Make I allow Dr. Israel respond to you.
Okay, when you say staphylococcus, I don't know why your friend will be struggling with staphylococcus or why you should be struggling with staphylococcus. Staphylococcus is a normal bacteria that is everywhere, and you don't need to be struggling with it because every part of your body, staph dey there. Staph dey there, so it's not something you should be struggling with it. If she never get belle, you should go and see a gynecologist. There might be something else that is disturbing her. You need to check other factors. And you should also remember say no be only woman dey bring belle to come, dey make belle come. Na two people, it's a partner thing. A man and a woman go need to come together, meet, make well. Then at the right time, then belle go enter. So if dem no dey do dat, belle no go vanish enter. And if dem dey do am all the time and e never still enter, dats why dem need to see doctor. The man go need to go to the hospital, the woman need to go to the hospital. Dem need to check themselves. E fit be say the man get some issues, e fit be say na the woman get some issues. They all need to check themselves. Make una leave staphylococcus alone. Staphylococcus no get wetin e dey do, no get wetin e do you or do dat your friend. Is for dat your friend to go to the right person, see a gynecologist, make sure that the husband also do test or the partner also do investigation, and then dem go come know if she go fit get pregnant or by herself, or if na every other assisted forms wey dem fit do for am, dem go do am for am.
Yes, thank you, Dr. Israel. I think I don't have any other thing to add again to this. Let me see. If you know, say you dey learn, click on the like button, like and share. Our people are very stingy with liking and sharing. You get the point. So as you dey ask question, like. If you never subscribe, click on the subscribe button, and then share, so that you dey encourage us. Somebody says, Doctor, What are the causes of asthma? Please talk about it. I'm a victim. So asthma, causes of asthma. Well. Many people get asthma. You understand? Asthma now wetin dey affect the respiratory tract. Most times, e fit be genetic. Most times, however, we notice say some people, wetin dey trigger for them na allergy, dust, smoke, and many things. Na im dey cause am. No be death sen ten ce. No be something wey you go dey shame about. If you get asthma, we go advise you avoid anything wey go trigger your asthma. And how you take even know say na asthma? No be say na people tell you, because most times person go tell you say I get asthma. You go ask am how you take know, and then talk say na so my friend tell me. So you have to be sure. You just feel be say maybe you get reactive airway, but no be asthma you get. So you have to be sure whether na asthma you get true. And then if you get asthma, avoid anything wey go trigger your asthmatic attack. And most importantly too, if you can't notice say you dey get asthmatic attack always, see your doctor, follow the advice wey dem give you, and use your inhaler, make e help you. Basically, na this little one we fit tell you for here. I don't know if Dr. Israel wan add anything for that.
Also, if you notice say you dey get attack often, try and check your environment. If it just be say you get something wey dey that environment when you dey react to all the time, and that's the reason why you dey always get those allergic. Now another um um risk factor for asthma na genetic. If person for your family get any allergic reaction or get asthma, you too fit still get asthma. Yeah. Okay, Dr.
Okay.
Fred.
Yeah, thank you, Dr. Israel. May we go to the next question from Johnson. I hope Johnson don't share this live session. Make I check whether he don't share. I want look for all the name of the people we don't share the live session. I dey check for their names. I they come. Mm. I dey check am with my other phone. All the people we don't share. Make I see. Make we see. Because this person they ask question, and I want they sure say whether he don't share. Okay, he says, please, I want to know what causes ulcer.
Okay, when you say ulcer, okay, I know say most of the time stomach ulcer, peptic ulcer disease, that people they always talk about when they talk about ulcer. So causes of ulcers dey many, but the major cause now the presence of one bacteria, what we dey call H. pylori, Helicobacter pylori. So if that bacteria dey inside the body, it can actually lead to ulcer. Actually, not be only ulcer e dey cause, but is more implicated in ulcer. So that na one cause of ulcer, that's caused by bacteria. Another thing, stress can trigger ulcer. Medication wey we dey take can trigger ulcer, mostly those wey dey take painkillers, all those strong painkillers. Say make dem miss am for you, don miss like three painkillers for you. You dey also dey give yourself problem, because it can actually cause ulcer for you. So I don talk stress, I don talk bacteria, I don talk medications. Yeah, for those wey still dey take too many spicy things, yeah, you are still at risk of coming down with ulcer. So those with spicy stuff can actually get that. So, and how you go take prevent am? If you know say you don already dey get all those burning sensation for your epigastric region or your chest region or close to your stomach region wey dey reach your back, you need to reduce so many things, your spicy food, your food, things wey contain a lot of gas or a lot of chemical. You need to reduce all those things, and with that you go just dey okay. Dr. Fred.
Yeah, thank you. And one more thing we I go add, I beg, if no be doctor confirm your ulcer for you, I beg, make sure say it is confirmed. Because some people go they talk say they get ulcer, whereas no be ulcer they get, if it be something else, now they get. So make sure it is confirmed, true, say na ulcer you get. Okay. Make I go to the next question. Make I go to the next question. Let me see. Okay, this question from here. It says, "Good evening, doctor. Please, what is the major cause of prostate? And is it true that it is because man not dey knack for long?" Mama allow Dr. Israel respond abeg.
First thing, there's nothing like what's the cause of prostate. Prostate, all man get prostate. It's one of the organ when a man body, and the prostate now one of the organ when see the help man, and then the help man they store sperm, and before man go come release the sperm during during menstruations. Yeah. So that is prostate. So yes, prostate can have problem. Can have problem with the prostate. The prostate can become enlarged. The prostate can be inflamed. They can have cancer. In fact, cancer of the prostate now one thing when if man too live long for life, he go quick get. He go always get. um If man too live long for life, don reach 90 years or so, e go always get problem with the prostate. E go either have enlarged prostate or even cancer of the prostate. So dat na wetin study don show. And also it's not because whether the man dey knack everyday or dey knack not less than 2 days. Dat there's no really a strong study to back dat up, to say because the man no dey knack all the time na im make e get prostate issue, prostate issue. So there's no studies that really back that up, and no good study that really back that up. So I will not be able to tell you that yes. We know say many people don come out to say yes and because man no dey it's not 100%, and it's not true because there's no strong research to back that up.
Yeah, thank you, Dr. Israel. So no be knacking, no be man wey no dey knack dey make person get prostate cancer. It is not 100% correct. Whether you knack or you no knack, if you like knack 1 million times, person wey go get prostate cancer, e fit still get am. Prostate cancer. Okay, share this video. People no dey share, people no dey like. I'm surprised you want us to answer you, but you are not sharing and liking. Come on, no be witchcraft be that. Share now. Okay, why patients suffering from ulcer of different kind hardly get treated permanently, or it can't be cured permanently? Ulcer can be cured. Ulcer can be cured. Just that the treatment for ulcer they can take time, and most people no dey like follow some of the advice wey dem give them. Ulcer can be cured. Ulcer na wound, for inside your stomach area or your duodenum. So na wound, and wound can be healed. But just that some people want make the thing heal immediately, immediately. It can take a while. And if you follow the advice we then give you, sure, also go. But for some other conditions wey fit be like ulcer, if you go dey treat ulcer, no know say na another thing you get. That is why we dey always emphasize say if you dey always get ulcer symptoms, confirm true true whether na ulcer you get. Make you no be say na another thing wey dey look like ulcer you get, you no go know. But yes, ulcer can be treated and cured permanently. Somebody's asking us about ulcer. Any other question about ulcer? I beg, we get video for the page, so that make we fit answer other questions, please. We have a question here from Ola Kunle. Okay, Kunle, I have allergies since 5 years now and been coughing since then, but breathing well. No loss of weight. Okay. I don't know. Treasure, what do you want to talk about this?
You don answer am now. You say you get allergy for 5 years. So if you are coughing, e mean say na the allergy dey give you the cough now. Yeah, you can be coughing often. The only thing you need to do is to find out what are those things I'm allergic to. If you can tell what those things you're allergic to, then you run away from those things, and most likely the cough may stop or the cough may reduce. Yeah, I know of somebody that have been coughing for a very long time. We've done all the thing, give all treatment, do TB tests like 1 million times, and still nothing happened. Sometimes we even treat for TB and after the treatment, she's still coughing. But the good thing is that the cough has reduced more than before, more than how it was before. Yeah, maybe because this person is not doing something different from what she has been doing. So the same thing with you. If you've been having this cough for 5 years, you need to check what are those things I've been doing that is that I think I should stop, or what are those things I've been doing that anytime I do them, the cough increases. So know those things, stop those things, and you're not just surprised that your cough will go on its own or will reduce to the barest minimum. And also, it's also a good time to see doctors that are specialized in that area, and your respiratory doctors. Hmm? The respiratory doctors will also help you so that they can take the cough, do tests for it, and find out what exactly is in the cough that you're having that is making you cough for long.
Okay, okay, okay. Questions done dey plenty. If I answer you, I will ignore you and go to somebody else so that make we fit answer more people. Good evening, doctor. What is the meaning of meaning your urine mixed with protein? What is the meaning your urine mixed with protein? It can mean a lot of things. It can mean a lot of things. Number one, there should be no protein in your urine. So if urine dey inside your protein, it means say urine don dey pass from your kidney enter the protein. Something fit don dey happen.
If protein in your urine.
Oh yeah, now yeah, oh yeah, go ahead. Continue, continue, continue.
No talk. You they say if urine dey your protein. Now I think
Sorry,
say now
sorry,
if
sorry.
protein dey your
Sorry.
urine.
If protein dey your urine, no vex. Sorry. If protein dey your urine. So if protein dey your urine, it means say protein don dey pass from your kidney enter. That is one. Another thing again, depending on the level of the protein, some e fit be very mild, small, one plus. Some certain conditions can cause that. You get how you go stress yourself. You get how your body temperature go dey very high. Some people fit get even discharge. We fit see protein. So just because say we see protein for your urine, no mean say you don get problem with your kidney. There are other things we need to check and be sure wetin dey go on. That is why we go tell you say we cannot conclude online say na the problem be this. Always see your doctor, make dem confirm one or two, because you no go just look the urine say you get protein for your urine, there's problem. There are other things we have to be sure about. So see the doctor wey recommend you to go and do the test and let them check you. Dr. Israel, we get this question here from David. What is the level of percent of alcohol that someone can take in a day that is safe? This person no dey follow us.
Um. Okay. There is no percentage of alcohol that you take in a day that is safe. Every percentage of alcohol that you take is detrimental, is bad to your health. May I use pidgin English? No amount of alcohol, leave the light. No amount of alcohol wey you go take wey dey good for your body. No amount. Every amount of alcohol wey you dey take, e get go give the body problem. Go give the body problem. Alcohol in the year 2023, WHO come out say alcohol is part of the group one carcinogenic substance. So one of the substance wey fit cause cancer for body, na alcohol be. So because of that, e is not safe for man to drink alcohol, to carry alcohol and start to dey drink. It's not safe. It's not safe. But you know say we don talk am now, and people still do wetin dey their mind. But it's just for you to know that there is no percentage of alcohol that you will take that is safe to your body. You can either increase your risk of having cancers like mouth cancer, throat cancer, stomach cancer, colon cancer, liver cancer, prostate cancer, breast cancer, and so on. So it is better you drink water, chilled water, cold water, than you are looking for alcohol to take.
Yes, Thank you for doing justice to that question. I am addicted to soda. Please, is there any risk? The answer is capital yes. Soda is not good for your body now. Abi, you want us to tell you that it is good? Huh? Wetin be your name? Your name na Natasha. Natasha Ogudu. Soda is not good for your body. Full stop. I don't know whether maybe people they want make we tell them say this thing good, so that they go talk say na those doctors na tell us make we dey drink am. It's not good, and it's not healthy for you. Let me see, let me see. Wetin be time? Okay, we will try to dey fast. Questions are plenty. We don already give you the advice. Abe, we have given you advice. Uh, Good evening. Please, I want to ask you. I am group O positive. Please tell me what kind of group O. Voila. My God. So I don't understand what you mean by what type, what kind of group O. You are group O positive, you are group O positive. There's nothing different. You don't have a sickness. Nobody thought say you get problem, you get one disease because you are group O. You are group O positive and you are blood group O positive. Full stop. That is your body. Just be like, doctor, why am I dark? Now because of your gene. That's what it be. Oh, doctor, why am I fair? Or why am I tall? So now so your body come, follow come. It's your genetic, and now so it be. There's no problem with you. Unless your question no dey clear to us to understand. Dr. Israel, this person says, is there any risk factor attached to soda addiction? Oh my God. Abeg, answer, abeg.
When you take too many of all this soda drink is also soft drink now, she
Yeah,
make I
soft
not go
drinks.
miss.
Soft drinks. Soft drinks.
When you take many of all these soft drink, all these soda drinks, they are more of refined sugar. They are more of refined sugar, all those many sugar, and they have a lot of color, a lot of other things, gas and all that. So it can actually trigger um in your brain, your body. Some of these soda also have caffeine, which can give you headache. It can increase the sugar level of your blood. It can cause so many things, and we know we always say too much of everything is bad, and too much of everything is bad. So I know you fit talk say at least now once a day I dey take am, but too much of everything is bad. So it's better you take it. And also if you want to take soda, no, it's no problem. But I think you should know your limit and try to reduce it so that may you not go cause problem for yourself in future.
Okay, okay,
Mm.
so there's a this question now set up. I'll tell you why now set up. I don't see a lot of people online. When you tell them, say, reduce these things or reduce them, they will come go another page, content and say, but they say we should reduce it, we should take it. And then the post that will content say those people that tell you to reduce it, don't mind them. You see, they want to be falling sick and want to be falling sick every time. That is why they did not want you to stop. So what now they try to tell people, we say, you know the truth, say this thing no good, but you just want a doctor to give you a way out so that you go fit use them as excuse. Shey you understand? E get artificial sugars, and we know that artificial sugars are not good for you. But if you are addicted, the best advice according to wetin Dr. Israel talk, try to dey cut am down small small, because addiction no dey easy. um E no dey easy to stop. Okay. Let me see. If you never share this live session, click on the share button. A lot of people never share. Oh yeah, share, share, share. We get about 20 minutes more. If you never share, click on the share button quickly so that we go fit take your questions. Oh yeah, share. Oh. This person says, please, sir, how can I treat hepatitis B?
Want to treat hepatitis B, go to the hospital. Go to the hospital, go and see a gastroenterologist. They will tell you what to do. Huh?
You don't hear. Go to the what? Go to the hospital. You cannot treat hepatitis B online. Go to the hospital. Yeah. Let me see. Let me take this question. This person says, "Good evening, doctor. Does smoking weed reduce sugar in the body?" Chai.
There's no relationship between smoking weed and sugar in the body. So the answer is no. In fact, smoking weed, you are causing a lot of problem to your lungs. Eh? So you are causing problem to your lungs, which is smoking, which can give you cancer and give you problem to the lungs and all that. If you get too many sugar for your body, you are tun- tuning to having diabetes. So you controlling that is not by smoking weed. They not get any relationship. So there's no benefit of it in smoking weed.
Okay. Let me see if we get another question here. Make I see. Make I see. Doctor, can asthma be cured? Can asthma be cured?
Actually, asthma cannot be cured. However, you can outgrown it. When I mean outgrown it, mean that you may get to the stage that you will never be feeling those symptoms again. Maybe because one, your immune system have outgrown it, or two, you have run away from all the allergies, all the things that can trigger you. So asthma is not curable because it's an allergic reaction. So every allergic reaction don't have permanent cure. The only way you reduce it or the only way you stop it is when you run away from all the things that can cause the allergy.
Okay, let me see. I dey try to see. Can the immune system fight off malaria, or I must take drugs? Note, I react to most malaria drugs.
Okay. Yeah, it depends on how high your malaria is before we can say the immune system can actually those fight off the malaria. So that is why first of all you must be you go must make sure say you must help yourself make you never get malaria at all by maintaining your immune system so that before the malaria come the immune system don fight them off. Yeah, that's the best way to help yourself. So you go need to prevent every form when you go fit take get malaria. So if even though na small one come enter your body, your immune system can actually wall off those small one, like one plus. Your immune system can wall it off because in fact we should know that malaria is an endemic sickness, disease that is e dey with us for Nigeria. For those of us wey dey Nigeria, malaria dey with us. So most of the time if you test almost 100 persons, 98 of them go fit show one plus positive, but then out of that 98 you about say 96 of them dey do their normal activities, they are not tired, they are not weak, everything is going on fine. Maybe once a while they feel a little tiredness, and if you do check well, you know say it's because those people are stressing themselves too much and all that. So for you, um when you come be say you come still get problem with the malaria drug, you need to make sure that your immune system dey very very good. Eat a lot of good food, eat a lot of fruits, drink a lot of water, try to dey rest, make sure say your windows get net, your door dey lock always and e get net, and if possible sleep under net, and you can fleet your place as many times as possible, with fleet wey no go cause you problem, so that you no go get any time any way wey you go say you go take get malaria. And even when the malaria come, because na small one go enter your body will be able to wall it off. But if you get the one wey knock you down, my sister, you go need to go to the hospital, and so that even though you dey react to the malaria drug, the doctors go be there to guide you through so that those reactions not go really come up.
Yeah, you got a detailed response. You got a detailed response from Dr. Israel. Yes, let me see if we get question. If you just dey come today na question and answer. Abeg, we know they make diagnosis for here. We know they give medicines. So in case you dey find us to give you medicine for here, sorry, you have to go to the hospital. Okay. Can immune can immune what? Can immune cure or fight prostate enlargement? No. Your immune cannot. If you have a prostate enlargement, your immune system has no relationship with helping you manage prostate enlargement. Your immune system no fit do anything about am. Is enlarged, is enlarged. You understand? And from wetin we don talk in the beginning, as man dey grow old for age, the prostate can be enlarged or the prostate fit get other problem. This one no get any business to do with the immune system. So your immune system no be like e go cure anything. No. Yes. Okay. Let's see if we can take some more questions. Make I dey check some questions. Um, Let me see this one. It says, how can you stop protein from passing through urine? Make I allow Dr. Israel answer because this person did not hear me the first time.
Okay. Yeah, normally protein no dey enter urine. Normally, protein not suppose enter urine. So if you find protein for your urine, it can't depend on how much protein dey the urine. If the protein for your urine dey very small, is not significant. It doesn't matter anything. Yeah, sometimes it may just be say you don't eat a lot of protein diet, so it go some protein fit escape. Sometimes it be say you stress yourself too much and your body break down so many things, some protein fit escape. And then if the protein don then notice say the protein many for your urine, they go need to do other investigation to be sure why that protein dey your urine. So na those investigation wey dem go do na go make dem know wetin dem go do for you, whether na infection o, whether na kidney problem o, or whether na just normal physiological activities na im cause am. Na only when dem do other investigations for you, dem go be able to na dem go fit take talk all these things or bring all these solution come out. So there's nothing when you say, oh, this thing I want to make urine protein not enter my urine. No, because normally protein not suppose dey urine. The body
Oh,
don already built for that.
thank you, Dr. Israel. Let me see. Good evening, doctor. Since I gave birth to my first son, he's up to 13. He has not sick. Does he have any problem? Is that what you are saying?
Wahala.
Your pikin never sick since you born am and he's 13 years. You
You should be happy now.
should be happy. Ah, nobody say problem
See
dey
whether you
now.
get problem.
No, madam, abeg o. We are not saying that everybody must fall sick. If your pikin never sick for 13 years, you should be happy, you should thank God. And anything you dey do for the pikin wey make am no dey sick, continue. Huh?
Continue.
Ehen. Anything wey you dey give am, wey you dey chop, wey you dey do, wey make am no dey sick, continue like that. Nobody say you must sick. No, no, abeg, abeg. You should be happy. Yes. Okay, we get about less than 15 minutes. If today na your first day you dey watch us, you dey welcome. This program holds every Sunday by 8 p.m. to 9 p.m. This program, Ask the Doctors. And me and Dr. Israel, we dey do this program for 5 years. They come every Sunday. So no be today we start. Today we dey take questions. Next week we fit teach on one topic and the other. We no dey diagnose online. If you get any problem, we go tell you make you go hospital. We no dey give anybody number. Make you come dey call. You get the point, eh? Uh-huh. Doctor, good evening, sir. How can I deal with heartburn in pregnancy? Hey. It's too much. Then sometimes I have headache. My BP, sugar is normal. No malaria. Dr. Israel, please respond, I beg.
Okay. Well, it's a normal thing for a pregnant woman to have heartburn. The reason is because as your belly dey big, the womb where the baby they push every other organ. They push all of them go different place. And the stomach na one of the organ where they push. So as they push the stomach, the stomach na one organ where they produce acid. As e push the stomach, the acid when the stomach dey produce, the stomach go still produce am. And that acid go come dey come out from the stomach, dey enter the esophagus. Sometimes they burn all those places, then they cause those heartburn. So what we dey normally dey say make pregnant women do if dem dey get heartburn, they should take water, and two, if dem wan eat, they should eat small small. Eat a little at a time. Not eat too many food. Eat a little at a time. um As you eat a little at a time, you no go, because the acid no go come and come dey burn every other place. The small food wey dey inside your small belle, na the acid go come out, come digest. Then you take water when you feel those pain. And also you can also report to your doctor during an ten atal. They go get one or two medication wey dem go give you, wey go help to reduce that heartburn. Na for headache, if you get headache, that make one of the medication wey dem dey give you na during your routine an ten atal na paracetamol. If you get headache, try sleep, try rest. If the headache no comot after you don rest, then take paracetamol, and with that the headache go actually go. Also make sure say you know your PCV, that is your blood level. Because if your blood level still low, e fit dey cause that headache small small. Yes, it's very good say you no get sugar and your BP is normal, is very beautiful, and you no get malaria, we no even want make you get, as far you get belle. So do all these few things when I just talk, and then try to dey rest. Make sure say you dey sleep on your left hand side. um With all this small small information, I think you will be fine.
Yes, we get about 10 minutes. Now, anybody will ask us question for ulcer, no vex. We know if you take your question, we don't answer them before. You came late. Make we know they repeat ourselves. So if you just they come and you dey ask us questions about ulcer, I beg, go back to the beginning of this live session. Follow. Watch wetin we talk about ulcer. You came late and we know they waste time for here. No vex. Good evening. I want to know what kind of test I will do because since 7 years now I have not taken, though I have two children. Your name now waiting. Your name now Joyce. So wetin be your name? I go advise you, instead of looking for tests, make you and your partner make una go hospital, because we mentioned this before. No be only woman dey give herself belle, na woman and man. Then they go check you, and then they go check your partner and find out if any problem dey. Most times women go dey waka different places, dey go travel up and down to drink things wey dem no suppose to drink, not knowing that the problem might even be from the man. So please, no dey look for wetin you go test online. Make you and your partner make una see una doctor. See a gynecologist, make dem check you, and then your partner too, dem go tell am test wey you go do. Una go do am, dem go see the results, and then they will come know how to progress. No dey waka dey go do test, because you go waste your money online. And when you waste your money, you go come dey cry. So we don't want you to waste your money. We want you to do the right thing. No dey waka for internet, they go find uh test to do. Dr. Israel, do you have anything to add to that quickly because of time? Okay.
No.
Um my cycle is actually not short, it's just normal. But I usually experience my period twice in a month. Very often. Is it normal?
Okay. If you don already talk say your period is not short, it's normal. It simply means that you know what normal is. So you try and calculate, do your mathematics yourself and calculate and do your monthly calculation, the month calculation. I really don't know what your cycle is, but to you, you said it's normal and it's not short. So do your calculation and you see that sometimes you may likely see your period twice in a month and it's not a bad thing. Yeah,
Mhm.
so it's normal.
You hear though, is normal oh. Seeing your period twice in a month for some women can be very, very normal. Okay, we go to end the live session. Let me see which question we get for here. Make I see, make I see, make I see, make I see. Let me see. Doctor, what can I do to increase my libido? I have no feeling for any man. Glory. Dr. Israel, I beg respond oh.
I don't know what you.
Oh God. You see why I told this kind of thing, eh? When we try to explain sometimes to some ladies, say this and this can happen. The same ladies go they shout for you, say shut up. Now money dey my mind. I know they think of man. So some ladies can be too engrossed in their life, in their business. So they no go think of man. You understand? Some other women, maybe then get other things wey dey happen to them. But the first thing wey I wan find out is it that you are married or you dey relationship. Because if you dey married and in your body no dey feel like to go near man, that one and that thing entirely, we need to find out. It's not normal. You dey relationship, that one is different. But if you are single, I no go even think make your body dey think of man. Focus with your life. When time reach, you go think of, you get the point. So different stages of your life get how we go handle am. This is the little I can tell you online, no, unless there is more. And if you know, say it is deeper than this, that one you call need to see doctor, so that may we find. But nobody will just tell you say you get problem like that immediately online. We are not quick to say you have a problem. Dr. Israel.
Yeah, if you really want. And most of the time, anything we do got to do with libido, got to do with your psychology. Yeah, it got to do with your psychology. So you need to retrace your psychology, your thinking, your mental health. So when you're able to work with your mental health, then your libido may come back to normal. And also, are you on any medication? Some persons they get some drug when they take, and those drugs will reduce their libido. So if you're on some medications that you have been on for a long time, that may just also be the reason why you're having low libido. So you need, if you are on medication, you need to count your cost, what that medication is doing for you, and the libido, which of them they very important to your life. So you also need to think that. However, if you think it's a very big problem, please you need to go to the hospital, see your doctor. Most likely a psychologist will be a very good person to start from, and then you know what to do for you.
Yeah, thank you, Dr. Israel. Make I see whether we get any question. Make I see, make I see, make I see. Oh, I defined, I defined, I defined. I dey check quickly. Make I see. I hope I no miss. Dr. Israel, if you see anyone, I beg read them all. Okay, there is no one. Okay, wait, with this one, quickly. This might be the last one because of time. Good evening, please. What is the cause of high blood pressure? Okay, Mo will take this one. This will be our last question for today.
Okay. High blood pressure get when you say cause, there's no really known cause of high blood pressure, and there's no really known cause. But we have risk factors, things when go fit predispose you to get high blood pressure. Yeah. So that's what we really have. So, and these risk factors are divided into two. We get the modifiable and the non-modifiable risk factors. When we say modifiable, we dey talk about those ones when you go fit change. And when we say non-modifiable, we dey talk about those ones wey you no go fit change. They are there, they are there. And one of the non-modifiable is age. As you grow old, most people are prone to come down with high blood pressure. Another one na family history. If people family get person for your family wey get high blood pressure, there's every ten dency say the individual go fit still fit get high blood pressure. Yeah. So um age, gender, family history, so those are some of it. Another one na your lifestyle. Dis one na the modifiable na your lifestyle. The kind of lifestyle wey you dey live go still fit dispose you to become hypertensive. You get too many weight, that is you are obese, overweight, dat one na one cause. You dey drink, you dey smoke, all those are also things that can lead you to become hypertensive. Yeah. So what can you do is for you to reduce all those things, because we said it's modifiable. You need to stop all those things, do exercise, change your diet and all that. So when even the another cause, the kind of food when you dey eat, food that contain high diet, high spicy food, high salty diet food wey contain too many salt, go still fit predispose you to get hypertension. So as I said, all these things are risk factors. Yeah. So they are all risk factors. Yeah. Dr. Fred.
Yeah, thank you so much, Dr. Israel. Make we call am a day here because of time. So, waiting go be your final words, and we are out of time.
Okay. For um I want to say thank you. When you say they follow us every day, every Sunday, they listen to all what we say. And for those when they take heed to our advice and do the right thing, as we say, make you do the right thing. I believe say as you have done them, you don dey see progress and you dey see improvement. I want to also tell you say take care of your mental health. It's very important. The world is not smiling, everybody is not smiling. And please, not hold anybody because e no fit do anything for you. Do your self thing for yourself, because nobody owe you anything, just as you no owe anybody anything. Dr. Fred.
Yeah, thank you, Dr. Israel. Thank you for watching. Thank you for spending your data here. Don't forget, now every Sunday by 8 p.m. we dey day here. So try your best not to come late, because if you come late, we no go fit attend to you. We dey very conscious of our time. So I want to say thank you. Share this live session, invite your friends, make them come learn. And like I always tell you, good life now waiting. Good life. Now sense. Take care and have a wonderful day. Bye bye. Wish you a good week ahead.